Welcome to the Dental Handoff. I'm Dr. Kelly Tanner, and today I have with me the king of oral pathology, John Svirsky. John, welcome to the show.
Thanks, Kelly. That would be me in my own mind. I've always been a hero in my own soap opera, so I'm probably not as good as I think I am, but I'm probably better than I could be. So that's where I am now.
Well, I think a lot of people might disagree because you do have quite a following. How long have you been speaking now?
Probably 35 years. I mean, on the national circuit, I think I really got on it years ago. The American Dental Association was looking for speakers on HIV. And I always wanted to be, I always wanted to be a national speaker. I think research was not my thing. I mean, I did stuff, but I think I'm a much better speaker than I was a researcher. So I remember one time there was this woman with the American Dental Association, Enid Neidel, and she was looking for speakers in a speakers bureau. I got in academics in 76. By 88, I was overnight success. It took me 12 years to perfect my craft. Everyone now wants to be an overnight success in one day, but it took me about 12 years because I worked on my humor as much as I worked on my content. And I think I'm known for the humor part. But I remember seeing Enid Neidel. I always wear bow ties. That's all I have is bow ties. So I go up to her. I have a Southern voice and some sort of weird voice. And I go up to her and said, I'd really like to be in your speakers bureau. And she said, well, we're looking for people, but you have to have the president of the VDA, which is my state, and the dean of your dental school recommend you. So I said, okay. So I had that done. And then I remember the first year, or this is after the first year, because the first year they'd already picked people. And so I said, if they ever had any openings to, I'd really like to do that. And so at the time I was getting paid anywhere from nothing to $100 to give a talk. And I remember one time I was giving a talk at a Kentucky Fried Chicken for a dental group, and we were passing around a bottle of bourbon. So I'm hoping I was hoping to go to the next level, which I guess I did at some time. But I'm at this meeting, and you're a dental hygienist, and you might know of her. She had the textbook on oral pathology that all the dental hygienists use, which is Joan Phelan. Does that name? I don't know if that rings a bell.
Yes.
She was my junior resident. So I was the chief, and she was
that's
my junior resident. And we're at this dental meeting in San Diego, and we're sitting next to each other. And Joan and I wanted to be on this speakers bureau because then I'd get, every time I spoke, instead of getting nothing to 100 and a bottle of bourbon, I would get $500. So all of a sudden I said, that was a lot of money for me back then because I wasn't making that much. And $500 was real money. Now $500 isn't real money. Well, it is, but anyway. So I'm sitting next to her in San Diego, and she says, John, you're not going to believe this. The ADA just called me to be on the speakers bureau. Congratulations, you really deserve it. Damn it. So I'm going, oh, crap. I wanted to be on the speakers bureau so badly. So I get home. This was 88. And I get home and there's a call from the ADA. And Joan and I were the two people that got on the speakers bureau to speak about HIV is what we spoke about.
Oh, wow.
And so whenever anyone called me to speak, I'd say, well, call the ADA because then I got $500. So I do. And that's how I became on the circuit because everyone saw me. I'm funny. And then I got to do oral path, but I got it because of HIV. I got it because of the ADA Speakers Bureau. And I probably did more talks. And then the ADA put me on, I was their media person. I was their media spokesperson. I represented the American Dental Association on Primetime Live. I was their spokesperson. And I was on some show by CBS, Street Stories. So my 15 minutes of fame was all related to HIV. So it got me on the circuit. It got me on television. It was a nice ride. So,
well, I met you, and a lot of people don't know this. Well, you and I have a mutual friend, Dr. Mark Hyman, but I even told Mark, he's like, John Svirsky. I was like, I have known John Svirsky since I was in my 20s when I used to work at Virginia Commonwealth University back before when it was called MCV. You remember how that was,
No, you didn't. It was 2002. That didn't happen. That happened in 69. It used to be the Medical College of Virginia. I was a freshman dental student when it became Virginia Commonwealth University. So in 1969, we went from Medical College of Virginia to Virginia Commonwealth University.
But you know that people still called it.
Oh, yes. And
it was a big thing. And then all of a sudden, it was a big thing that you could not call it that because it was not that.
Well, it didn't exist, and people wanted on their diploma. My classmates did not want VCU on their diploma, and I said, "Well, you probably should get it because that's what it's going to be. That MCV is not going to exist anymore. And it'll probably last until about when you're talking about. By 2002, it's over. There's no MCV anymore. No Medical College of Virginia."
Yeah, so I knew about you. I mean, of course, I was this little newbie just coming out, just coming out of graduate school, teaching at the dental hygiene. And then you're this big name and a big personality, right? And they're like, yeah, he speaks on a national circuit. And I think the Office of Continuing Education told me about you. And I was like, what does that even mean? Because, just
I didn't know what it meant. I had no idea. I told you I was a hero in my own soap opera, so it's okay.
It was crazy because I would see you in the classroom and I'm like, wait, how does he do both? And it just didn't hit me until I knew. And you even shared with me that in 2002, it's when you first got onto PowerPoint, right?
Yeah, it took me until then to get on. I mean, I think people got on at the end of the 90s, but I realized my 7-year-old daughter or something at the time probably taught me. Any little kid knew how to do PowerPoint. I didn't know how to do PowerPoint.
So what did you do before that? Because you're going from oral pathology slides.
Oh, yeah. You know what I used to do? I'd carry, if I was going out to California to give, a lot of times I'd do 2 days of lectures. So that's 4 courses. And I'd carry these bags with like 14 or 15 or 14 carousels. I'd have these bags. I'd get on the plane. I wouldn't check them. I'd have to put them up above. And it was horrible. And then you drop them or you couldn't change them. Like I could be in my room now. Obviously, you can change a lecture in a minute. But back then, it was a big deal. And if you dropped a carousel, oh my gosh, it was horrible.
Yeah, your whole lecture's messed up.
Yeah, so it took me a while. I fought it. And, I don't like change. When things are working well, it's a Machiavellian type thing. You don't want change. Things are good. Let's keep it that way. But,
Right. I remember in the basement at VCU Dental School, you probably remember this, where there was a place where you could go. I remember when I was at the dental hygiene department, we were digitizing things. So we were taking photos and probably slides, and it was down the basement. Do you remember that?
I remember there was this machine I could take a picture of a slide on.
Yes.
And I was trying to digitize all my slides, but then I realized because I had an old slide carousel. I gave it to the person that replaced me at VCU. She wanted it. And it has all my lectures. You pull them out. There's like 30 trays of 150 slides probably about 150, maybe 100 slides. I don't know. And each of them was a different lecture. And then I'd always use 2 carousels. So I'd have 2 projectors going. And then one of them would get stuck and you're going, oh. It was a big change. Yeah, PowerPoint simplified my life, and now there's all these new things. But I'm stuck in the old things. I'm not going to change now. I'm happy with PowerPoint. I'm happy.
Yeah, we have Zoom. You can do webinars now. Think about not even having to have the carousels to reach people online forever in perpetuity.
Well, I look at my life. I retired in 2020 from VCU. And I always tell people I retired because of institutional dementia. I'd been there too long, and I had enough. I'd reached my limit, and so I had a whole big life planned. So I retired in February of 2020. I had 17 programs that I flew to scheduled for that year. I had 3 trips to Europe planned. We always take my 12-year-old grandchildren. I have 11 grandchildren, and we take them at 12 to England. And so we could do that trip. And then I had 2 other European trips planned. And then COVID came in March, and my wife and I had never lived together full time because I'd always been working or doing something. And all of a sudden we're together 24/7. So it was a big awakening. I think it was actually tougher for her than it was for me. Although I was also going to be a docent at the Virginia Museum. I love art. And I was being trained to be a docent, and I lost that too because I couldn't do it on the webinars. It was driving me crazy. I really needed the hands-on in this case.
Right.
So I lost my 17 courses. I lost all the trips to Europe. I lost my docent thing, and all of a sudden I have nothing to do. And so I started doing webinars. I mean, I always did them some, but I started doing them. I mean, I got good at them. I probably did 100 webinars in COVID, at least 100 webinars during COVID. And it actually made me a better lecturer. I
Yeah.
mean, I can interact in a webinar. People can talk to me. I have someone like you that will feed me questions. And so as I get the questions, then I can deal with the audience, and I can still be humorous in a webinar situation and still make it interactive. So I think I got really good at them, and I did a lot. I mean, it's like you got to do 10,000 things to become perfection in that. Like dentistry, you got to do that 10,000 preps. Well, I don't think I did 10,000 lectures, but I bet I've done 1,500 lectures. So, I mean,
Wow.
that's a lot. If you look at my career, and when I was working, the economics of being a professor was not real good. So I mean, I had kids in private schools, I got colleges, and so I needed to find a side hustle, and then speaking became what I loved. And so what I realized when I retired, I could make a living speaking. I mean, maybe not the same as when I had my practice. No, I wouldn't make it the same. But I still found that I thought psychologically it was kind of neat. I saw that I really could make a living if I had to make a living doing this.
Yeah.
So instead, I did fine. I mean, don't cry for me, Argentina. It was a good run.
So it sounds like you are really good at reinventing yourself too, and you're still You just got back from a trip from Africa. I mean, so I sense now. I knew you in a different capacity and know you in a different capacity, other than like being BFFs. But I sense, John, that you've always been the person who is open to say, okay, even though change is hard, but you're open to say, okay, let's learn something new, or let's be open to that, or wonder if it could be done that way, because you have a curious mind.
Well, you need to do something. What I find is, if I don't do this talking, what I'll become is, if I don't, keep doing what I'm doing, I'll become talking furniture. I'll be like those people in Hyde Park in New York that just babble incessantly. So this way, at least I have a venue for my, I like to speak. I'm very type A. I'm very extroverted. And it can drive people crazy, but probably ADHD too, who knows? Because, focusing, I can focus if I'm into something, but if I'm not into something, my attention span probably isn't good. And so staying home during COVID was a time to reinvent. It was also, you needed to figure out what you can do with your life, because you all of a sudden, how long is this going to last?
Right.
So I probably, at least, I used to run. Now I walk. I think at this age, walking 15, 16-minute miles, every day seems to give me some exercise. I think I need to do stretching. I think that stretching would help me. I wish I would have started stretching years ago. So I can reinvent myself. I'll try to reinvent myself. Although I think I'm only going to speak 4 more years. I think that I'm going to go out, and I think I'll call the groups, let them know this is it, swan song. If you want me, 4 more years, and then I'm done. Because
Last tour.
as I told you, I don't need the economics anymore. I mean, that's done. I mean, if you don't have,
just let that out of the bag, people are just going to get you to come for a
a
bottle of bourbon.
depends on the travel too. I don't want to kill myself anymore. I mean,
So you've seen everything. You were talking about how you got onto the circuit of HIV. Let's contrast that to where we are now and what we're seeing in oral pathology. What has been probably one of the biggest disruptors that you've seen since HIV, or maybe your top 2?
Well, I think if you look at since HIV, the things that I'm looking at now, like vaping, I think that's a real big deal. And I think that HPV, human papillomavirus, I think is a big deal, because I think it's amazing that they have treatment for HPV. Stage 4 HPV, you can live. I mean, it's not a great treatment. It beats the living crap out of you. I mean, it's like you're being cut, burned, and poisoned, but they give you 70 grays of radiation for oropharyngeal cancer, which is horrible. And then they give you cisplatin, which enhances it. And you can't get cures, but you can put people in a pretty much a permanent remission. Whereas stage 4 oral cancer, you pretty much die. They don't have any real good chemotherapy. And what works for the oropharyngeal cancer is the radiation. And that's why people could have a lymph node out here and live and be fine. Fine, not as good as you were, but pretty good.
Right.
Oral cancer, you have a lymph node out here, you're dead. I mean, pretty much you got metastatic disease. So I'm seeing that. I'm seeing the new product I think is going to make Philip Morris a lot of money. It's called Zyn, Z-Y-N, and all the kids are using it. You can hide it. I was at the Hinman meeting and I just learned about it. I hadn't known about it for more than a year. And so I was speaking. This guy said, "You want to try it?" And I said, "Sure." So I'm speaking and I stick one up there with 6 milligrams, which is way too much. It's the high dose. I didn't know that. I just stuck it up there. Within about 3 minutes, I was feeling like I wanted to vomit. I was feeling lightheaded. I guess it's acquired, but it's a real big jolt of nicotine. So, I think people are going to be using this all the time. I don't know what's going to happen. I don't know swallowing it, what's going to do to the cardiovascular system. I don't know. Like vaping, we know that you're not going to die of cancer, but you are going to die from lung disease, a good chance, especially if you use flavoring agents. So I think these are things that are on the forefront now. But I think look at Zyn, you'll see that. That's going to be a big product. I think vaping's down a little bit because I don't think they're making the money on vaping. Although I think they were reprehensible. What's the Juul, that company? They targeted teenagers. I targeted middle school, middle school, and get them addicted. 15-year-old brains get addicted pretty easily. So I think those are big deals in, I don't know if that's oral pathology, but when I talk about oral cancer, those are big deals.
Yeah, I was having a conversation the other day as it relates to AAP staging and grading. And I was thinking about how on the AAP staging and grading with periodontal disease, I know this isn't your shtick, but the consequences.
I can take up my tooth.
That's cute. Okay.
That's cute. I had endo, I had a post and core, and the post and core came out. So guess what? I'm getting an implant, but I don't even wear this thing. But I figured it's going to be. I'll find out Friday when they take the tooth out whether it's going to be 4 months or 8 months. If they can put an implant in, it's 4 months. If they can't put an implant in, I got to bone wait. It'll be 8 months.
Yeah, I just got my implant on number 3.
You got your first one?
Say again.
It's amazing.
It's great technology.
And I don't care what the cost is. I just want that damn implant in. But I haven't been that bad about going without my tooth. It is what it is.
Yeah.
At your age, I would. Yeah, bother me more. At my age, I don't really care.
I know. Well, we're in the smile business too, though. So it's like,
well, I'm not in the smile business.
I know.
I'm a dentist, but I still smile. I just don't have a tooth.
But with vaping, with the advent of vaping and all of the different things that are in the vaping, I was thinking that there should be some type of implication for the flavorings and all the stuff that's in vaping.
That's what's dangerous. The flavorings is what's dangerous. It's going to kill you. It's going to be just like, I think what they use in the analogy is popcorn lung. Hairdressers used to be around hairspray all the time and inhaling that hairspray, and they get sticky lungs, which would lead to, pretty bad things, pulmonary fibrosis. They die from it. I think the flavoring agents, especially in a young kid and putting them in their lungs, cannot. I remember when it first came out, I said, you can't get a good outcome from this.
No.
Oral cancer, no big deal. You're not going to get oral cancer from this, but you are going to die from, I think a lot of people die from lung disease. And they've shown that. People have died. Someone had a double. In November of 19, there was a 17-year-old kid that got a double lung transplant because of secondary to vaping, but people have died. So, yeah, I think it's a big deal.
Yeah, there's just so many, and there's so many things that you can guess will occur. And it's, you have this hypotheses of, I think it's going to cause this. It could probably cause that. And then 10 years later, all these studies come out. I tell oftentimes that it was back when diabetes, we weren't really sure that it was directly correlated with periodontal disease and all the other things that it's correlated with that oral systemic link. But I had in my mind, I said, something is not right with these diabetic patients. They're not healing. Something is going on with that with the system and the gum disease and their insulin. Don't know what it is, but it's years later that it comes out, oh, it's linked. It's not just linked. There's this synergy that one causes the other.
But I remember reading a book years ago, the China study. I remember I got really big on this, and really about juvenile diabetics. Why do you get a juvenile diabetic? It's not the same thing as, you have what happens? Why doesn't the insulin work? And in the hypothesis in the China study was cow's milk, that kids aren't used to, the milk industry and the meat industry sell their products. And maybe it isn't good for everyone, but there was a hypothesis of that. I mean, I haven't drank, it had nothing to do with diabetes. I just don't drink milk. I tried it. Well, part of it's lactose, but
right.
I don't have, I don't have any milk except, okay, I have cheese. It doesn't bother me. So who knows?
Yeah, but all the things that we kind of like say, I think there's something to that. I think there's something to that. But then years later, we can truly connect the dots on it.
A lot of diseases with perio associated with the gums. I mean, heart disease and stuff. They were talking about a lot of things that have a big association. I think that one of my friends is a gastroenterologist. He's retired now, and great guy. And he says he's going vegan. He says, I'm seeing too many young people getting colon cancer.
Oh,
It's got to be the processed food. I mean, all the foods that are so over processed and the diets and stuff. All of a sudden, why have we changed it? 50s when you get your colon exam? Well, now it's 45, and it's absolutely going to be 40. And a good friend's daughter just came down with colon cancer at 45.
wow.
And my daughter-in-law, who's an incredible runner. I mean, she didn't run in college, but she runs 38-minute 10Ks, and she's 47. She wins her age group in the marathon in the 10K. But her brother-in-law died from anal cancer. And so her daughters, who are now in college, they're twins, took that as a cause celeb. You got to do something in high school. Well, they started a fun run for, cancer below the belt. They did all this stuff for that. They were on television. They were doing all this stuff. And their mother, who at 45, probably wouldn't have gotten a colon exam. But they made her get the colon exam, and she had a polyp the size of a golf ball. Now, if she had waited to 50, she may have been dead. It's like, they took it out, but the idea was that she may not have gone and gotten it. So I mean, I'm real big on, I think you got to get your colon examined. I think now, 45 the minimum, but I think it's going to go to 40. It worries me but I do think it's a diet. I think it's processed foods.
Mm-hmm. Yeah, it's everywhere, and it's way more economical than spending money on like the good stuff. The good, wholesome, good for you.
In England, it isn't that expensive compared to here. I don't understand why organic is so much more expensive in our country than it was in England, which surprised me. And another thing that surprised me, in England, they got smoking out of the pubs well before we got smoking out of Virginia. So I think some of these things are amazing that in England, where you never thought they get smoking out of the pubs, they got it out pretty quickly.
Yeah, I wouldn't have guessed that it would have been that easy.
I don't know if it was easy, but
yeah. So, John, looking back at all the great things that you've done, all the different places you've traveled, all the people who you've talked to and, for, and lives that you've connected with, what would you say, looking back, would be advice to yourself?
Well, I mean, it's easy to give it. I mean, it's easy to be a hero in your own soap opera, but I mean, what I feel is do what you love and love what you do, and it's never work. And I think I pretty much have done that my whole career. Now, could I do it again? I don't know if they'd let me. I don't think the school would ever let me travel the way I traveled. So, I mean, some of the things that I was allowed to do to build my speaking career, I don't know if they let faculty do that anymore. I think it'd be hard to do. So I just tell people, if you don't like what you do, switch. Find another career. You're going to live 90 years, or maybe. And if you don't like something, there are other things you can do. And I remember an Ann Landis quote. She was someone before Dear Abby or something like that. I don't know if that you would remember that, but some of the younger people here won't. But I remember this guy said, I'm 44 years old, and I really want to go to med school, and I'm really too old, but I mean, to be 50 when I get out in 6 years or whatever it is, or 4 years in some residency. And she said, well, how old will you be in 6 years if you don't go to med school? And I thought that was, I thought that was great advice. But if you want to do something, do it. I don't think age or anything should stop you. I mean, I know money's a big issue, but people get in a lot of debt. But
I know. And I hear that a lot of, I don't want the debt. I'm going to be too old. And I say the same thing. Life and time is going to pass either way. So what are you going to do to live out your passion and what it is that you truly want and your gifts that you're meant to give in this world? Because I know for sure that with your students who sat in your classes with the oral pathology, because I walked by them at Virginia Commonwealth University and the lights were dim, you were going through the slideshows, going through, but there was laughter. There was always laughter. And I think that if you tried to take one or the other out of it, it probably wouldn't have worked. Like if you tried to be the serious oral pathologist, it wouldn't have worked.
A lot of speakers can give material. A lot of speakers are smarter than me, but I think you need to be an edutainer.
Yes.
For people to listen. And so I found that's always been my gift. I think what I'm noticing on the circuit now is these two pretty women are replacing me. It took two pretty women to replace one ugly old guy. And I notice what's going on. And they are good and they are smart, but they're not as funny as me. And so
I know who you're talking about. Who's as funny as you?
I think that there used to be a guy, Marvin Berman, who was a pedodontist. He was like Joel Grey from Cabaret. I mean, he actually played him in Cabaret, but I think he was really funny. I think there's some people in some of the speakers on the circuit now are really funny. If you look at the speakers that are my generation of speakers seem to be this same type. Like I'm in the middle of the audience and I see a lot of speakers like that. I think Mark's very funny. Mm-hmm. And so I think a lot of speakers of that ilk are really funny. So
yeah. But it's hard to, I bet it would be hard to kind of stand back and say, is that how I was? How was I when I was that age or when I was that tenure in speaking or, wondering if you were the same or contrasting yourself.
Over my career, if I look back 35 years.
Yeah. Yeah.
I was more polished. I'm more polished now because I think I know my material better. I think it takes 10 years to really know your material so I can answer the question. So again, I go back to that statement I said earlier. I was an overnight success, but it took me 12 years. I think a lot of people don't realize you can't just all of a sudden do what I've done, but I worked on it. I mean, it wasn't like it was even my humor is sort of rehearsed because I know how the audience can respond, but I can interact and I know how to take it any which direction because I've done it so many times.
Right.
So I think that's my gift is interaction. I can always interact. I know that some people don't like my humor. Now I stick in rock stars and things and very few, fortunately, very few. I don't read my reviews anymore. I used to read them and take them personally. Now I don't,
Now you just don't read them?
Are they going to fire me? If someone gives me some of the people that see my things, they send me anything you think would really be pertinent, but I don't either. I'll look at them sometimes. I can't say I don't look at them, but I don't take it personally the way I did when I was younger.
Yeah.
I know how people are going to respond to me. They've always responded to me this way. I know that a couple of people won't like me, and most people love me, and so I'm not going to dumb down. I'm not going to change my lecture for people because sometimes the ones that complain the most are the people will listen to them too much, and I think that's wrong. I know how I lecture.
Yeah. So
hopefully I can do it a little bit more. But if not, that's been a hell of a run, Kelly. It's been a hell of a run.
Yeah. Well, you've impacted a lot of lives and helped us educate ourselves along the way about how things are evolving. You have amazing course titles for your courses.
Well, I did work on those. People call me. I help people with course titles. Dean DeLuke was trying to do one for local, anesthesia. He won't take my title. I thought it was fabulous, but of course it's inappropriate. But I said local anesthesia is more than a little prick, and I thought that was a great title. And he won't use it, but I bet you though someone will.
That's great. Hey, you heard it here first on the Dental Handoff from Dr. John Svirsky.
Tell Dean DeLuke to use that title. He probably won't see this. He should use it.
Well, John, it has been such a delight to have you on and to see you and to see where your path has been just from my viewpoint of watching you and all the greats before me on the circuit and in education. So thank you so much for taking the time.
Thank you, Kelly. I've enjoyed talking to you. I remember when you were a little girl. So now you're grown up. You're grown. Yeah. So
I was right down the hall from you.
It's like the blink of an eye.
It really is.
It's the blink of the eye. And, now I have 18-year-old granddaughters. I'm going, how did that happen? How did I get so old? But you have no choice. You either get old or you die. So
yeah, you take care of yourself.
I'm hoping to keep playing. So we'll see.
Yeah.
Well, thank you for inviting me. I enjoyed talking to you. And so,
well, likewise. And for all of our listeners, if you want to get in touch with Dr. Svirsky, his notes and the show notes at the bottom is where you can find that information. And for all of our listeners, thank you for all that you do every single day. And I always ask a favor for you to go on to Apple Podcasts and give a 5-star rating, please, my friends. And go on over to YouTube, like, subscribe, and share with friends who you love. And until then, we will see you next time. Thank you, Dr. John Svirsky.
It's a wrap, Kelly. Thanks.
It's a wrap.
See you, girl.